Clinical assessments showed differences, even with the same mutation. After diagnosis, both children were evaluated in detail. On cognitive testing, their scores were below 40, suggesting significant intellectual impairment. In daily life skills assessments, the brother needed some assistance, while the sister was fully dependent on others. Autism evaluations showed no autism symptoms in the brother, but the sister showed some autism-related features. What's especially important here is that even though they developed symptoms around the same age, their presentations were different. This suggests that a genetic variant alone doesn't fully predict the final clinical picture. Factors like overall genetic background, individual nutrition and diet, environment, and developmental differences may influence how symptoms appear and progress, possibly through epigenetic mechanisms. Treatment and recovery. Once the diagnosis was confirmed, doctors started calcium Leucovorin calcium folinic acid right away, gradually increasing the dose early on. The response was striking. Both children had a clear reduction in seizure frequency, and their language and social skills improved. They still lagged behind peers, but their symptoms stabilized, and their quality of life improved significantly. Why this case matters. This story highlights how critical early diagnosis and treatment can be. At the beginning, the symptoms were relatively mild and not very specific. But with neurological exams, CSF testing, and genetic testing, the true diagnosis, CFDS, became clear. In this condition, FOLR1, mutations prevent folate from being transported efficiently into the brain, disrupting normal neurodevelopment and brain function. And because CFDS can look like more common conditions, such as autism, epilepsy, or other neuropsychiatric disorders, it's easy to miss. So, when a child shows severe regression, ataxia, or motor instability, intellectual disability, and drug-resistant seizures, it's important to consider metabolic and genetic testing. Early diagnosis and treatment can help prevent irreversible cognitive damage and can significantly improve cognition, seizure control, walking ability, and language skills, ultimately giving children a better quality of life.